Hi everyone, my name is Sue Anderson and we're here today at Conneaut Lake Veterinary Clinic with Donny Consla, and we're going to do a program today from my dog and me entitled The Geriatric Pet. And first of all, Martin, this is Martin. I guess we should introduce you to Martin. This is my 10-year-old some of this and some of that, because he's the classic mutt. But we're going to talk a little bit about Donny first to let you know a little bit about why he's here, why he came to Conneaut Lake, how long he's been here, and things like that. So, Don, we're going to start with you.
All right.
How long have you been at Conneaut Lake?
I think since about 2006. I started my junior year of high school as a veterinary technician.
Was that a shadowing program or something like that?
Yeah, I started as a job shadow, and then after about a few months, a position opened up, and I got hired as a full-time technician.
So how much have you done that? And you did that all at the end of high school, through college?
Through high school, through undergrad.
Okay.
I went to Allegheny College, so I was able to stay local and keep coming here. And then through veterinary school over the summers when my wife and I would be back, and on like Christmas vacation and stuff like that.
And where did you go to veterinary school?
Western University in Los Angeles.
Oh, you left the eastern part of the United States to go way out there.
Uh-huh.
All right. And how long is that, just for those people that aren't aware of that?
It's 8 years total of college.
4 at Allegheny and then 4 out there?
Yeah.
And then you had to do internships certain places?
You can go on to do an internship if you'd like to specialize and become like a cardiologist or something like that.
And therefore, I would assume that you are just a general veterinarian?
That's correct.
Do you have areas of interest more than others?
Small animals, so dogs and cats.
Okay.
And then I also really like exotics, like birds, lizards, small
Snakes?
mammals, snakes, rabbits,
God.
chinchillas.
Okay, well, I was okay when you said the dogs and cats. When you went into that exotic thing, not for me. Okay, so you're here at Conneaut Lake, so you're back to your stomping grounds, and
Yes.
you're not back and forth to California anymore.
No.
And your wife, what is she teaches, doesn't she?
Yeah, she's an elementary teacher, and she's starting at First District for third grade.
Third grade, okay. And our special guest today.
Yes.
This is Martin, and we've got to see if we can get him. Can we move him back just a little bit, maybe on the table? Oh, he's so nervous. Okay, some of you may know Martin because Martin has been a therapy dog in Crawford County for the last 9 years. His claim to fame has been that he was the very first dog that was ever a therapy dog at the Cancer Center at the Yolanda G. Barco. And he also does a lot of the school programs, and he also does some of the school programs, right, and Yolanda G. Barco, and he also does some private therapy visits for people. But he's getting old. And he's my oldest of my 4 dogs. Many of you know I have 4 different dogs. And he's my oldest, and Martin is now 10. So what is a geriatric pet?
So a geriatric pet comes in anywhere from 6 to 8 years of age. We start to calling them geriatric. And there's that difference in age because a lot of it depends on the breed and the size of the dog.
Okay.
So we know that small breed dogs like chihuahuas,
He's going
I've got exotics on the brain
I
now.
saw that.
Chihuahuas or Pomeranians, they tend to live longer, 14, 15 years, sometimes even longer than that. So, more around 8 years of age for them, we start calling them geriatric. A larger breed dog like a German Shepherd or a Bernese Mountain Dog, more like 6 years of age, because we know their life expectancy isn't quite as long.
Okay. All right, so now I'm the owner of Martin, obviously. And what are some things that I need to be aware of as just overall that I can observe about a geriatric dog? So what are the changes I would see?
There's some benign changes or not serious changes that you might notice at home, like some changes in the eyes that we'll talk about. And then there's other things that may be more of a problem. Some generalized stiffness could be signs of arthritis, which we can manage very well. Other things that could be signs of a bigger problem are increased drinking and urination, change in appetite, overall lethargy, bigger signs of illness like that might be more concerning.
Okay, so now I make my appointment, I talk to the receptionist outside, and what's probably something that she should tell me that I can bring with me so we can use that also to diagnose?
Well, she'll probably tell you to bring a fecal sample.
Okay.
So you can bring that in just a little Ziploc baggie. We only need a small amount, like 1 gram, so we don't need the whole pile.
That's good to know.
Yes, it is. Sometimes we get some exorbitant presents, but that's okay.
I bet.
Lots to sample from. But that's probably the only thing you need to bring physically. Sometimes notes are helpful if you've been noticing some changes, some different things that maybe Martin's been doing or different behaviors you've been noticing, and you know how frequently those things occur. That's always good to know.
Okay, so I have 4 dogs. I have a large yard. I put them out, and the phone rings. I run inside to get the phone, and now I have no fecal sample. What are we going to do about that?
Well, when you come in, you tell me that story, and I'll send you with a little cup. So when you go home, you can walk Martin around and make sure you get just his sample.
Okay, is there anything else you can do here to help me out with that?
Sometimes we can go in digitally, which means a finger, and get a sample that way.
And you sometimes do that?
Sometimes.
Okay, and what do we look for in the fecal?
We're mostly looking for eggs of gastrointestinal parasites. So around here we usually see roundworms, hookworms, and whipworms. Whipworms aren't as common in the rest of the country, but in this area we see more of them than usual.
Is there another type of worm besides that?
There's also tapeworms.
That's the one we don't want the dog to have, is that right?
Well, we don't want them to have any of those worms.
Any of those worms, but is that the most difficult to deal with, the tapeworm?
The tapeworm, it's easy to deal with, but we just can't see it on the fecal flotation.
Oh, okay.
So usually we see the little segments of the worm on the back end of the dog. They look kind of like little grains of rice.
Okay.
And so usually that's kind of diagnostic for that type of worm.
Okay, so we walked in the door. What's first on our agenda here? Do we have to change places, or
we'll change places?
Okay,
yeah.
we're going to change places, and I'm going to get the back end. That's always nice.
Okay.
Come back here, big boy. Okay. So what are we going to do here?
Yeah. So usually I always start just getting to know the animal while I talk to you about Martin and what's been going on. So this is where I'd review his vaccine history, what medications he might be on, any supplements he might be on. Ask you some questions like, is there any coughing, sneezing, any vomiting, diarrhea, change in water consumption or urinations? Have you noticed any seizures, anything like that? And that can kind of help us focus on areas that might be a problem.
Okay, so you're asking me what he's been on, and I'm going to tell you that he has had stiffness for a long time. In fact, I think Dr. Stanton years ago said his hips were absolutely hardly any socket there whatsoever. So we put him on Dasaquin, is that what I use?
Dasaquin, yeah.
Dasaquin, and he has been on that all his life.
Good.
So he's been on that for 9 years, and he doesn't take, Martin, I don't think he takes any other medication of any kind. That's just about it, and that has done well because he's a good runner and he still does well. The only thing he can't do, of course, is from his condition, is he cannot stand up on his back legs for any long period of time. But other than that, that's the only thing that has ever happened to him. I'm sure some of the viewing people will agree with this, I probably have spent less money on this boy, this is my some of this and some of that, than I have on my 3 pedigree. And I don't know, why is that?
A lot of times the pure breed dogs just tend to have more genetic conditions related with them. And so we often see those diseases more in those purebred dogs. The mixed breed dogs, because they don't have that sort of genetics, sometimes they can get away from certain things. So they're still going to get some issues like degenerative joint disease or arthritis, but maybe they're not going to get, hip dysplasia like a large subset of German Shepherds have. That's not to say that a mixed breed dog can't get some of those things because they do have genes from those specific breeds. So it doesn't always guarantee you that they're not going to get some of these diseases, but sometimes it's less likely. A
lot of people now are really big on trying to figure out what these mixed breeds are. I think there was a program we did not too long ago, and I think it was with Royal Canine, I think was the name of the company, where they would take a sample and send it away. It's a little bit different than maybe the over-the-counter or money-making deal that some others have. And we did it with a dog up at Canberra, and we were trying to guess the breed. Martin kind of tells you in a way what he is, because of course he's got the coloring for the Rottweiler.
Right.
And I do believe his mother's a Border Collie. And other than that, maybe a little bit of Black Lab, and that's about all I know. But a lot of people are really into that now, because they want to know what their some of this and some of that really is.
Absolutely.
Okay, shall we start with the exam?
Okay.
Okay.
So I usually start up here at the head, and he's nice and calm. We'll take a peek at the teeth. Okay.
His teeth aren't bad. I think they've been done once.
Yeah, they look pretty good. He's got a mild amount of tartar.
Right.
So given his age, I can suspect that they've probably been cleaned before.
They've been cleaned once, and this is amazing. He never leaves, his entire life is spent with a bone. He chews bones, maybe 1, 2, 3, laying around him every day, all day.
Yeah.
In fact, I think he probably goes to bed with one. But I think that's a good indication. Some dogs aren't big bone chewers.
No.
That has an effect on the teeth?
It does. It's especially helpful for the back teeth, where, a lot of this tartar and things like that tend to build up. And so, they put the bone in the back of their mouth and they can kind of grind some of that off. But this is where I usually talk about what you can do as an owner at home for your dog's teeth. And my favorite thing is brushing the teeth.
Oh, yes. And that is my most unfavorite thing, even to discuss. But people do that, don't they?
Yeah, and it's the most effective and the cheapest thing you can do at home to care for their teeth. And, even once a week can help slow the progression of dental disease. Every day is ideal, but I know that's not always realistic.
With multiple dogs, that's not such a good idea.
Yeah. But his teeth are looking pretty good.
Yeah, they're not too bad.
Yeah.
Now, what about his eyes? Can you see anything from his eyes, just in general?
So let's take a peek here. So I know you mentioned to me that some of your friends had noticed some changes in his eyes.
Just a little bit. They said there was a little bit of puffiness below them a little bit. He's always had such expressive eyes. That's why he's been such a favorite with people, and so soft and kind looking. But
so I can tell you, if the light hits these just right, can you appreciate that they're a little cloudy in there?
Oh, just a little bit.
Yeah. And that's a normal age-related change. It's called nuclear sclerosis, which is a fancy way of saying scarring of the lens. So what happens is, as the lens gets older, the cells of it die and kind of build up around it. So, when skin cells die, they can just fall off and go off into the environment. But in the middle of the eye, you can't just have these dead cells floating around everywhere. So they build up around the lens, kind of like the layers of an onion. And so when the light hits it, it has more tissue to go through, and it looks a little cloudy.
A lot of cloudiness in the eyes, then. Is that something people should be concerned about?
No. And it's often mistaken for cataracts, where cataracts are like more of a mineralization of the lens, and that prevents light from going through and can cause blindness and lead to some other problems. With this change, light can still go through. They can still see. It affects their near vision a little bit, but otherwise they can still see.
So I shouldn't be overly nervous, and just, if I have a question, come see a veterinarian, one of our local veterinarians, and say, hey, is this really cataracts, or is it just a normal aging?
Right.
Gotcha.
And we can always look, and when I look in his eyes, I can see the reflection from the back, and so that's how I know it's not a cataract, because I can still see that reflection coming back.
That's good news there, Martin.
Yeah.
What else do we need to look at here? What about that? And I noticed he's a little bit graying on the muzzle.
Yeah, that's also normal for our older pups.
Of course, on the black ones, you really see it.
Yeah, absolutely.
Because there's a contrast there.
And I've seen some dogs that are, 4 years old and they start to get like a little gray.
Oh, wow.
And then other ones, like Martin here, he's 10 and he doesn't have that much really,
no,
but it's starting to come in a little bit.
I actually dye it every morning. I don't brush his teeth, but I dye his fur. No, that's not true, I don't. But that would always be an option, I guess. Maybe not.
Good. And so I'm looking at his face straight on. There's good symmetry. There's no drooping of the eyelids or his lips or anything. So that's telling you about the neurological function in his head. So that's all good there. So let me sneak behind you here.
Do I need to change places?
No, you'll be good. We're going to take a peek in his ears. Look at the outside. There's no redness or debris. A lot of times, older dogs that have had chronic ear issues will start to see some changes of that because of repeated ear infections. So the ears will become kind of thickened and even more predisposed to some ear issues.
What about the smelly ears? Is that a clue of anything?
Yeah. So
pick up the ear and you go, oh my God, the ear is terrible.
That's usually a sign of an ear infection.
Okay.
Commonly, yeast or bacteria is what we isolate. So whenever somebody comes in for an ear problem, we like to get a little swab, look at it under the microscope with a specific stain, and that tells us what's in there so we know how to best treat it.
Okay, here's a trick question. Down ears or up ears have more infection?
Neither.
About the same?
Yeah. So there's an interesting study that came out a few years ago from the veterinary dermatology group. The dermatologists do all the ear stuff, and they looked at German Shepherds versus I can't remember what other.
Or even one like him, because his are definitely done
with just floppy ears. And the German Shepherds and some of the other erect ear dogs had more ear infections than some of the floppy-eared ones.
Oh wow!
So
how about a Basset? There you go, floppy down to the ground. Do you want to talk about floppy ears? Okay.
Now there are some dogs with floppy ears, like Cocker Spaniels, that it's not so much the floppy ears that's the problem, but there's other issues going on there internally. So even though they have floppy ears, they get a lot of ear infections, but it's not necessarily associated with the type of ear.
We talked about the down ears and the up ears. What about the smelly dog breath? Something I should be concerned about again?
And that's usually an
Okay.
indicator of the dental disease.
Okay.
So, you know, I'm right here in his face, and it's not overwhelmingly stinky.
It smells like a dog.
It just smells like a dog.
Okay,
Yeah.
you're good there, Mark.
And so we know by the little oral exam that I did that there's, you know, no rotten teeth, no, you know, gingivitis or infection or anything going on in there.
One of the things that you looked in his ears, but the only thing, again, as an owner that I've noticed is that his hearing's not as good. Now, I can always say that that's selective. He isn't really trying to listen to me, but sometimes I have to really work to get his attention, especially when he's outside or further away. Probably, though, that if I open the treat bag, I think he hears it right away. But that sometimes is another sign of the geriatric pet.
Right.
Okay.
Oftentimes, as dogs age, they tend to lose their hearing, and it's a lot of the lower sounds that go first. So, you know, sometimes we notice that the crinkling of the treat bag they still hear, but if you think about it, that's kind of a more high-pitched, high-frequency sound.
So I should speak in a real high-pitched sound if I want to hear me. I'll work on that. Okay, we're going to change places here? Or are you going to
I'm going to keep going around this
right.
way. Another thing that people often notice is some changes in vision, such as their dog might be going blind. With the hearing going, we usually don't get too worked up about that. When vision starts to go, I would say that's it could be a more serious scenario. So sometimes dogs will their retinas will slowly degenerate over time as they age and they'll lose vision. But if there's any sudden vision loss, or you know, you really start to notice him bumping into things at home, we should see the dog sooner rather than later, because there's oftentimes something going on somewhere else in the body that's causing those changes in the back of the eye. And sometimes if we can get ahead of those things, we can actually prevent the blindness or bring back some partial vision.
The only issues that I've had with him recently is he's crazy about eating his feet. But I think that's the allergies. Maybe it's just the season or the type of weather we've had. But he can chew his feet to the point that he has me crazy. And that's probably my biggest issue with him.
That's a very common clinical sign that we notice with seasonal allergies.
Right.
And you know, there's a whole big workup we can do for that to confirm that it's allergies. Unfortunately, you have to kind of rule out everything else before you can say it actually is allergies.
Well, that gets us to the point of a geriatric pet, and I feel very strongly about this, but if I have a dog, and this is my personal opinion, this is not your opinion obviously, but if I have a dog that's young, that's 2 or 3 years of age and has issues, I'm all for let's find out what it is, because I want that dog to live the 10, 12, 13 years.
Right.
When I get a dog that's 10, 11, or 12, I tend to be a little bit more cautious about what I'm going to do, and honestly, what money I'm going to spend out of my pocket to find out something when he might have 2 or 3 years, but he certainly isn't looking at another 10 or 12.
And this is what I always tell people. If we do all these tests, what are you going to do with that information?
Correct.
If you told me that, you know what, even if we found out he has allergies, I'm not going to do allergy shots, or, you know, if we suspected a tumor somewhere, if you said, you know, if we do the ultrasound and all the tests, but we're not going to do chemotherapy or something.
Then why are we doing all the tests?
Maybe we don't need to do the test, unless you really want to know what's going on. But if you're not going to, you know, do anything about it, then maybe we don't need to invest resources in that and put our little four-legged friend through that.
Right. That's an interesting theory. If you're not going to do something with the results, then why bother many times doing the test?
Yeah.
Because
sometimes, right. And sometimes there's a few scenarios, often with masses, where I'll say, you know, maybe a test is warranted, so we can at least find out what it is. So we know maybe the aggressiveness of the mass, so we can get an idea of how much time we have left. But yeah, sometimes, you know, maybe we just don't need to do all that type of thing.
Well, now while you're looking at him and checking him out, what about behavior changes that occur with an older dog? Now I know there's an older dog that's in our pet therapy group, and I tend to find that dog is having a little bit more issues as far as patience, and so kind of overreacting a little bit. Is that something that sometimes occurs with the age of the dog?
Yeah, so we'll see behavioral changes, and sometimes it's mild from just not, you know, being as active as they once were. And then sometimes we see more signs of dementia or canine cognitive dysfunction.
Do they have that?
They do, yeah. And so a lot of times those dogs will present just waking up in the middle of the night, or, you know, just standing staring at a wall, crying out, you know, just very, very odd behaviors. And, you know, we have to do some tests to make sure there's not some medical cause behind it.
Is that blood tests? generally?
Usually some blood tests to make sure the liver's working appropriately, so there's no like toxins leaking into the bloodstream. A good neurological exam to make sure there's no other deficits that might clue us into maybe there's something going on in the brain.
So in other words, this dog can suffer from the same issues that the older person does.
Absolutely.
Okay, I never realized that. I never realized that dementia would be something that somebody would observe.
And we're starting to recognize it more now, probably because we have better medicine than we did years ago. So dogs are living longer. So they're not, dying at a younger age from this disease or that. So they're getting older, and now we're starting to notice some more of these changes.
Well, we talked before about checking out or doing the teeth and all those kind of things. But I guess as an owner, on some of these things, I need to keep a record. That if I see these things and I find out that once a week Martin is up and standing looking at the wall, I better keep track of him doing that or how long he's doing that. I remember I had a dog one time that had seizures, and he had seizures starting at age 3, so I had a lot of paperwork there. But I would write down exactly what time the seizure started, how long it lasted, what did I give him, and stuff like that. So whenever I came to the vet and I was asked by Dr. Wade or Dr. Stanton, what are you finding? I'd pull out my piece of paper and I'd say, well,
I'm so glad you asked.
Yeah, in the last month I noticed that we had 3 episodes of seizures or something like that. So there's a responsibility.
Yeah.
And I think it's being the proactive owner.
And it's very helpful for us when you come in to say, okay, he had a seizure this date, this is what he was doing beforehand, this is how he recovered, and this is how much time lapsed between the next one. That's very useful information for us, especially when we're trying to come up with diagnostic and treatment plans.
Well, and we talk so much about this. Well, I don't mean to. You can keep on examining him. I'll just keep on talking to you. But the other thing that I've noticed a lot of is that I think that an owner, just like the parents of somebody or the children of somebody that's in the nursing facility, need to be advocates for their parent who's at maybe one of the nearby nursing facilities. I think, and I really talk to people about this all the time, I think it's so important for every dog owner to be an advocate for their dog.
Yes.
You know that dog better than anyone. I remember one time I was here with Dr. Wade and I said, it was one of my smaller dogs, and I says, and so-and-so's doing this, this, and this, and none of the tests showed that. And I remember I said to Dr. Wade at the time, but Dr. Wade, that dog is with me. I touch that dog constantly. I know there's something going on there. And because of my persistence, and because I kept on saying, this and this and this, we were able to narrow something down. So I think that the owner has to do that.
Right.
And some owners don't do that enough. I think, I'm going to just go into the vet's office. It's up to you to figure out what's wrong with my dog. It really helps if they have
the more
as much
information we have from you, it really does help us, because you're with the dog,
Right.
all the time. I see it for 15 minutes, once a year.
Yeah.
So having all that extra information is really a big help.
Well, now you were just examining him and feeling for things, and we always have fun whenever I'm here, because usually Martin sees Dr. Wade, and we'll always say, where are those little bumps that we found before? And then we have to go searching because they're hard to find, they're so small. But it's so important for an owner, and I'm sure you would agree with this, that you touch your dogs constantly and run your hands over them to see if you find anything that just isn't quite right.
Yeah, and I can't tell you how many times, an exam I'm feeling all over the place, and the owner's like, I found this, this mass, and I'm like, well, geez, I didn't feel anything.
Yeah.
I was looking really hard, and then they come up and it's this pinpoint type of thing that nobody would ever detect on their exam, but because the owner is touching and feeling every day, they found it, and now we can document it and monitor it. And
on the chart that you have of the dog.
Yeah, we have a little lump chart that we keep track of everything.
I've seen that.
Every time the dog comes in, we find all those and add any new ones, and adjust for changes in size, shape, or color, anything like that.
Well, we always laugh because sometimes we can't find them again.
And, sometimes they're like little sebaceous cysts, as gross as that sounds, and they'll be there one exam, and then they kind of rupture, and then they're gone.
Hey, let's talk about something. What about hot spots?
Yeah.
Because he has had them. And he never had them, and then about a year ago, all of a sudden, doggone didn't want to show up, and I was feeling, and I thought, well, there's nothing there, and I thought, wait a minute, doesn't like me touching back there, and I went digging, and doggone, didn't we have a hot spot? How common are they?
Pretty common, especially this time of year.
Oh, really? Okay.
2 most common causes would be fleas. So they get a flea bite, have a little allergic reaction to it, dig at that area, and you get a hot spot. or environmental allergies. So the same thing that can cause the chewing at the feet, the recurring ear infections, can also cause some hot spots and things like that.
Okay, now my dog's getting older, and there are certain things I might do differently. What about the fleas and the heartworm? Can I stop doing that whenever he gets to be 10?
No, I would keep up with it.
Okay,
and,
I do.
And it's kind of the same reasons as why we do it when they're younger. Heartworm disease is an incredibly easy disease to prevent with the monthly preventatives, but it's very difficult, dangerous, and costly to treat. So even though you might say, oh, maybe he only has 2 or 3 years left, having heartworm disease could make a huge decision in how much time he has left.
Hey, what's that newest thing that they're doing? It's a collar that is for fleas and ticks.
And ticks, yeah.
What I just saw it on the news, and I know somebody. Somebody down here mentioned it to me one time. What's that called?
Seresto collar.
Does that work?
Yeah, they work pretty well. And there's some other companies that make one. I think Bayer's the one who makes the Seresto collar. But it's kind of like a new age flea collar. Normally we try and stay away from flea collars because they're not very effective. But now some of the bigger companies are making these new generations of them.
Remember years ago, it used to be the Hartz Mountain collar, and everybody said, oh my God, I hate those white things. They're so dry and they're so yucky
right,
around
that's got
them.
the powder, but
Yes.
these seem to be pretty effective. They don't have, like the powder coming off of them. You can get like little reflectors on them to kind of decorate them a little bit, make sure your dog's visible at night.
That's what you need,
we have a few clients that use them, and they seem to be very happy with them.
Okay, he's a therapy dog. Is that going to come off of my hands at all whenever they're petting him?
No, and that's kind of another benefit of it is that you don't have those greasy spots
Right.
going down the back. Alternatively, there's another new product out that we've been carrying called NexGuard, and it's an oral flea and tick preventative.
Does that, better than doing this down the back?
It's just a preference. I think they're all equally as effective, but it just depends on what you want to do. So some people don't want to have to go, rooting through the fur and find the skin, or have to worry about their, children or, grandparents touching those like greasy spots or getting stuff on the couch, whatever it may be.
Sure, he's a therapy dog.
Yeah.
So whenever I put that on him, he's out of work for at least 2 or 3 days or a little bit longer because we don't want that on him. Especially now, it's not so bad with him because we can hide it.
Yeah.
But with some of the short-haired dogs that would use it, you see those spots right down the middle of the back.
Right.
Do they all work the same?
Yeah, it's all pretty much it's the same general drug class, some slight tweaking in the molecules, but they all work pretty much the same.
Price-wise? I know the flea and tick collar is what, 7 or 8 months?
Yeah, I think it's up to 8 months depending on the activity of the dog. So if they're in, the pond every day, it's only going to last, like 4 to 6 months.
Okay. Okay.
So I was back here and I'm feeling his abdomen. His is nice and soft. There's no signs of pain. And we're really feeling in an older dog for masses back here. Splenic masses of the spleen are very common. Masses in the liver and lymph node enlargement is also something that we can often find.
Someone like this dog, I don't know whether people are realizing this, but this dog doesn't really care about too much.
Yeah.
So you can do a lot to him, and another dog may overreact and turn that head around real fast and say, hey, what are you touching me for?
Right.
Martin would say, oh, that's okay, just do whatever you want. So we've got to really be aware of what's happening with him because he is so passive. It's very, very hard to catch something happening with him.
And so, if we did feel something, usually at that point we recommend, say, x-rays or an abdominal ultrasound to kind of help us figure out exactly where that mass is, what organ it's associated with, see if we can maybe get some samples of it, and kind of discuss things from there.
Okay, now what type of tests are we doing on this boy?
So
overall tests.
For the geriatric dog, all of their wellness tests like the fecal flotation and the heartworm, tick-borne disease test we still recommend.
Okay.
Just because they can still get those diseases. Again, they're easy to prevent, harder to treat.
If he's on heartworm every day, all year long, does he still have to have the heartworm test?
Yeah.
Okay.
Nothing is 100% perfect.
All right.
And so I always recommend getting the test anyway.
It used to be, I think, that if you were on that all the time, the bigger concern was the people that take their dogs off it.
Yeah, in the winter or things like that.
Now, can people take their dog off that type of stuff?
I wouldn't, and because there have been some studies that have shown that dogs that were only on it in the summer and off of it in the winter still got infected.
Okay. Well, the therapy dogs were obviously on all the time, so.
So other tests we talk about doing in older dogs, some blood work. We usually recommend a complete blood count, which is going to look at white blood cells, which may tell us about any signs of infection, or a low blood cell count for other sorts of specific diseases. The red blood cell count, so if there's any anemia present, and also the platelet count to let us know if there's any clotting disorders. And then the other thing I usually recommend is just a basic chemistry, and that's going to tell us about how the liver's doing, how the kidneys are doing, and some other metabolic values like protein and glucose. And that's kind of a good snapshot of what's going on in Martin's body.
And now we're going to talk about what type of a cost am I looking at. I don't have a lot of money, as the average owner doesn't. What are we looking at that run these tests?
Off the top of my head, I'm not sure, but I would say probably for both of those 2 blood tests, probably 100 to 150.
Okay.
And ideally we look at those every 6 months in an older dog, because changes can happen very fast, especially if there's a mass or something involved. And so the sooner we can catch those changes, the sooner we can do something about it.
What other vaccinations am I going to do in this big boy?
I usually recommend keeping up with their regular vaccines, dependent on their lifestyle, of course. So rabies they have to have by law, so that one we don't even need to worry about. The distemper-parvo combination, that's good for 3 years. We booster it every 3 years.
Should I do that for him?
And so if he's due for it, I would say go ahead and do it. Some people say, you know what, he's older, I really don't want to vaccinate him, it really tires him out, does he really need it? And we can do what's called titers on the dog, and that's where we get a blood sample and send it off to the lab, and they'll measure the amount of antibodies that Martin has in his body to those specific pathogens. If they're still high, within a certain level, we can say, okay, his immune system still has protection from those viruses and things, so we don't need to give him another vaccine.
A lot of people don't do that, though, do they?
A lot of people don't do it, but it is an option.
It's more expensive.
It is more expensive.
Okay.
And then, the other vaccines are still lifestyle oriented. So kennel cough, for him, if he's at the bark park running around with the other dogs, if your dog goes to the groomer or goes boarding anywhere, they should have the kennel cough vaccine. That's not one they need to have every time they come in. So if you said, Martin's not going to be around any other dogs for the next year, and then, 9 months from now you say, oh, hey, I'm going on vacation, he's going to be boarding, you can just pop in, we can get him updated on the kennel cough vaccine.
What about, let's go to talk real quick, because I wanted to mention something else or ask you something else. As far as the worms are concerned and stuff like that, if he were to have worms, and I have 3 other dogs, isn't it usually then that you'll say to me, you just might as well do it for all of them, because if they're all in an area and they're all walking around and the poops, even though I pick up poop, I don't pick it up all the time because I don't always find it, but you sometimes then treat all the dogs?
Yeah, that's right.
That really helps too.
Yeah, they're spread by the fecal-oral route, so if they're out there sniffing around, licking things, there's a good chance that they could also pick up the worm. Now, the heartworm preventatives also prevent against those GI parasites, so that's another layer of protection you can have if they're on that medication for the heartworm as well.
So what else should I do about this boy? Anything else? He's not in too bad a shape.
He's looking pretty good.
He is. He still runs. He still barks. He still thinks he's in charge.
Another thing I was doing back here is I was palpating all of his joints. And like you said before, he has a history of some issues with his hips.
Right.
And I can tell he doesn't let me pull his hips back as far as I would expect. In a normal dog, you can get him straight out. I can probably get, 45 degrees, which isn't surprising. I can feel like a little bit of grinding in there, which is also expected, knowing that we have some arthritis. I like to do, pick up the toes, flip them over, make sure they still have good neurological function. On him, it seems a little delayed, but it's just because his legs are a little weak. So if I support him and do it,
then it's a little bit different.
Then he puts it right back over.
Okay, what am I going to do about his food?
For older pets, they make special senior diets.
Okay.
We know older dogs aren't as active, and they don't always process things quite as efficiently. So the senior diets tend to have higher quality protein and things like that, and easier digestible components that can keep them nice and healthy.
What about water? Should I watch his water consumption?
So always have lots of water available, just in case they need it.
And fresh water.
And fresh water.
Not one that has been sitting there for 4 or 5 days.
Okay. And if you notice any changes in water consumption, that's kind of a red flag that we need to know about. There's a myriad of different diseases that can cause changes in water consumption and urination, but that's kind of often the first sign that we see.
So the whole thing is back to the fact that I better be a pretty good dog owner and I better be watching for everything. Anything else we need to do?
I don't think so. I think he looks really good.
So he's getting up there in age, Unfortunately, the other thing we're going to be looking at some point is what are we going to do whenever he's no longer going to be that active or he has some issues. I'm a very strong believer that, and this is me again, as a crazy dog owner, I believe so much in quality as opposed to quantity. I don't believe that we keep on putting things and doing things to a dog just because it's going to extend his life or that dog's life just for my sake. So we have to talk a little bit about that. I think that's something that a lot of dog owners kind of get caught up in, is not knowing what to do.
Right.
And then whenever we finally make that decision that we're going to not allow him to continue, then that's something we would talk to with the vet.
Right. So I always tell people to have some benchmarks in place. And I think the easiest way to do that is pick your dog's top 5 favorite things that he or she likes to do.
Okay.
So maybe it's fetching, maybe it's getting a specific treat like, you know, frozen yogurt in a Kong, maybe it's greeting people at the door, whatever it may be. Write those 5 things down, and when those 5 things stop happening, then you know that maybe their quality of life is beginning to suffer a little bit. When they don't get excited over those treats, when they're not greeting you at the door, when you get their favorite ball out and they just kind of look at you and...
Like, yeah, why?
Right.
You know, it was interesting. I had a collie, and it was whenever Dr. Stanton was here, Alan Stanton, and I had decided what my benchmarks were. And a collie, and I think Cody probably weighed like 90 pounds. He was a big boy. And I had decided the day he got down and couldn't get back up, that was going to be my decision. And I remember I was looking out in the backyard, and he got down, and he could not get up at all.
Yeah.
And it was at that day that I said, this is it, because I cannot, first of all, who can lift a 90-pound dog? That's really tough. That's a little bit of the advantage of the smaller dogs.
Yeah.
But I think it's easier to make a decision if you decide those benchmarks in advance. Otherwise, again, it's me speaking, I think you have a tendency to keep moving the benchmarks because you don't want to make a decision on the dog's life.
Exactly, and that's the importance of making them ahead of time, because otherwise, as you're going through, you know, you notice the changes, but you notice them kind of in real time, and you're like, oh yeah, you know, he seems a little slower today, but you know, maybe that's just today.
Yes.
And then next week, you know, oh, he's not interested in his ball, but you know, maybe that's just today. And then you get, you know, several months down the road, and you kind of look back with hindsight, and you realize all these things that have happened. So if you have those things in place, you can kind of be on the lookout for them, and it kind of helps with decision making in the future.
Now, you've seen a lot of the examination that Dr. Consla did with Martin, and let's say that we now have made the decision that because of various things, he's not moving very well, the 5 things that you talked about, he no longer likes to do, and my belief in quality versus quantity. Let's talk about how, and I've come in and I've said, you know what? I really think that he's hurting, he's got some other issues, his blood work's not real good. I don't want him to suffer, Dr. Consla. I want him to have a good life to the very end. So what are some things that you asked me, or what are some of my options as far as making the decision to end Martin's life?
Sure. So first, you know, you and I would talk. We kind of reaffirm everything that you're saying, and I'd just give you some other options. So you may be leaning towards euthanasia, but I could say, you know what, you know, given the changes on his blood work, we could try this.
Okay.
Or if you're interested, you know, we could try this. Some people, you know, kind of have their mind made up, but they don't know that there's any other options out there. So a lot of times, you know, the diseases that are going on, maybe we can manage and give them good quality of life for a little bit longer. That's not always the case, but sometimes it is. So sometimes just presenting some different options, a different angle, is a good way to kind of start off the conversation.
Okay, so I've decided that I can't do it. Now, what are my options that I can do? If I come to you and I say, all right, I want to do this. Now, I know that a lot of veterinarians, and I know that Conneaut Lake also does it, if I don't want to bring my dog to the veterinarian clinic to have my dog put down, then a lot of veterinarians, and I know that, as I said, Conneaut Lake does it, I know some other ones do, you would go to someone's home.
Yeah, we can make arrangements to go to the home and help with that.
Okay, now, should I, when I put my dogs down, now one I didn't, one I was in South Carolina and had Dr. Wade be in charge, but my other dogs, I have been there. What about, do I say to you, should I be there? Can I not be there? Should I be there? Oh, is it going to be terrible? Am I going to be upset?
Right.
Is something going to go wrong? What are you going to do to make me feel better about this?
It's totally up to the person whether or not they want to do it. A lot of people want to be there, you know, this is their part of their family, and they want to be with them until the very end, which is a great outlook. Other times, maybe it's just too emotionally taxing to actually be there for this. It's a difficult decision to make, that you actually have to make for the animal. And that can be a lot to handle sometimes, and some people just don't want to be there. And, oftentimes an argument is, I don't want my last memories of my dog being him being put to sleep.
Right.
And so, they can take all the time they need with the dog, say their goodbyes, and, it's still not leaving on a happy note, but,
it's a little bit easier for them.
It may be a little bit easier. So either thing is fine, but it really just depends on the person.
On contrast, I've decided that even though I know I'm going to do it and I've made that decision, of course I don't do it lightly, and usually the tears are coming down my face at the same time. I'm not doing well with this, but I want to make sure that the very last thing that this boy sees, whenever I put him down, I want him to see me.
Yeah.
So that's my reassuring thing to him, is that if I'm here and if you're looking at me, you're okay. We can do this.
Right.
Now, you normally do a mild sedative to start with?
Right. So I always like to start with a sedative, just so they're nice and calm, they're not in any discomfort, there's no anxiety, anything like that.
And that's no different than taking blood from the dog?
Right.
Okay.
And we usually just give an injection in the skin, kind of in this area, and it takes about 5 to 10 minutes to take effect, and in that time, the owner can spend time with their dog, and just kind of, we bring in nice fluffy blankets, and they can be nice and cozy, and just a quiet environment that you can spend some time with your buddy.
Okay, and then I've spent that 5 or 10 minutes, and now you're going to give the injection that's going to cause the end of the life.
Right, so we pop in and say, are you ready? Some people might want more time, other people just want to get going. And so the injection that we give is actually an overdose of an anesthetic. And so what happens is, before any changes happen to the body, the dog falls asleep first.
Right.
So it's a very calm, very peaceful transition. And so they don't notice anything that's happening in their body.
Right.
They don't notice, the change in their heart rate or their breathing because they're sleeping. And so the sedative's on board. I usually try to go in the back leg in a vein back there so that the family can be up by the head of the animal, like you said, snuggling with them.
Sure.
And we give that in the vein, and slowly they fall asleep first because it is an anesthetic, and then the heart and the lungs will stop working.
Okay. And most of the veterinary clinics give several options. Option number one is you can take the dog home, and you can bury the dog somewhere on your property.
Sure.
I do believe it's probably against the law, but everybody in the world probably does it.
Yeah, I think if you're in the city, I don't
think it's a little tough to be doing that.
Yeah.
But a lot of people, especially around here that have farms, that's always one option. Okay, so I don't want to take the dog home. Can you do something? Can you get rid of the body for me?
And so we have a few options there. So the first is cremation, and you can decide whether or not you would like to have the ashes back or not have the ashes back.
And that depends on the veterinary clinic, because veterinary clinics do that a little differently. Some deal with other companies and stuff like that. Okay.
So for us, you have that option.
Right, and I think they all probably provide that.
Yeah, and so that's nice, especially for, say, people in the city who don't have the land to bury their animal or don't have the ability to do it. You can get the ashes back and do something with those if you'd like.
Okay, that's one option. What's the next one? What's my next one?
So there's also the pet cemetery.
Pet cemetery, another option.
You want to talk about that a little bit?
Well, out at Conneaut Lake we have the Forever Friends Pet Memorial Park, and people can choose to bury their dog there. They can do one of two things. They can do a basic burial, which is just a biodegradable container, and the dog is usually buried down, I think we usually go down about 4 feet. Or if they don't want the biodegradable container, we do have the people that feel very strongly about using the casket, which is airtight, watertight, has a mattress, has a pillow, and it has a little coverlet. And a lot of people like that.
Yeah.
So that's another option. And with that, people then can decide on a marker. But they can do a marker even if they're in their yard or anything like that.
Right.
Is there any other option?
And finally, if you don't want to do any of those, then we can dispose of the remains for you.
So there's lots of options out there, a lot of things you can do. Again, so very, very, very important to talk to your veterinarian about this.
Absolutely.
Know what choices and why and make sure that you're comfortable with that choice. And then furthermore, make sure that the veterinarian knows what your plan is, and make sure that you discuss with them if you are a little confused on what we've discussed. make sure the veterinarian's going to tell you what you can expect when you do it.
Right. This is a very big decision, and so we want you to be well informed and know why you're making this decision, and most importantly, to be comfortable with this decision, both for your dog and for you.
Right, and that is so important. No one, I mean, it's the hardest thing. I see so many people who say to me, I said, did you ever have a dog? Yes, well, I had a dog, and I just could never get another one. And my comment always is, you have so much love for a dog and so much love for animals, and you could be giving it to another one. And someone said to me, but they'll never be the same. I said, I've had 6 collies. They've all been different. And because I put one down never stopped me from getting another one. So I think that's something a person has to work out. And think about that and discuss it with friends and family and, of course, the veterinarian, and know what decision you want to make. But we're not planning on doing it for this boy for a while. Do they ever just fall asleep at home?
Sometimes.
Could you work on that for me, so I don't have to deal with anything other than that? That would be the easy way. People always say, I'm going to do that, and I say, that doesn't always happen.
Yeah. It really depends on what the underlying problem is, whether or not that happens.
It'd be nice if they just rolled over on their side and that was it. Sometimes that does happen, because I've been called to go and help someone remove the body of a dog that has done that. Okay, well, that was a tough discussion, even for me.
It is tough.
Yes, and I've done it so many times, and I'm standing here with my boy, and to think that I'm going to have to make that decision is tough, and you can see why people suffer so much with that.
And it really helps if you can, put some thought into it beforehand. If you can pick out their favorite things, it doesn't make the process any easier, but sometimes it can make the decision making a little easier versus just coming to the vet, getting a bad diagnosis, and kind of have to come up with a decision more on the spot. Not on the spot, but sooner rather than having some time to take.
Okay, well, thanks very much. We appreciate your help with that. That was a tough discussion to have, and we seem to have gotten through that very well. So,
in the future.
Anything else I should remember about my geriatric pet here? Because he's my old boy.
Be observant. Let us know of any changes that you see, and as best as you can, try and keep up with their regular routine veterinary care.
Okay. Well, thanks. I really appreciate you taking the time to do this. We wish you all the best of luck in the world at Conneaut Lake Vet. I'm happy you're here because this is where my vet is. And you'll undoubtedly get to see my 4 dogs. And thanks again, and we will see you again.
Okay, sounds good. Thanks for having me.
You're very, very welcome. Thank you.